Cervical cancer develops in the cells of the cervix, which is the lower, narrow part of the uterus that connects to the vagina. It almost always develops slowly over time, starting as precancerous changes, dysplasia, before transforming into invasive cancer. 1. Primary cause: HPV infection, persistent infection with high-risk strains of the human papillomavirus. HPV is the primary driver of cervical cancer, present in more than 95% of cases. The mechanism: high-risk HPV types, most notably HPV 16 and 18, integrate their DNA into host cervical cells, producing viral oncoproteins, E6 and E7. These proteins disable cellular tumor suppressors, like p53 and PRB, leading to unregulated cell division and the accumulation of genetic mutations. 2. Histological types. Cervical cancers are categorized by the type of cell where the malignancy originates. Squamous cell carcinoma, the most common type, accounting for roughly 80% to 90% of cases. Originating in the ectocervix, the outer part of the cervix, lined with squamous cells. Adenocarcinoma originates in the glandular cells of the endocervical canal, the inner part of the cervix. These can be harder to detect early via routine cytology. 3. Clinical progression and staging. The progression from a normal cervix to invasive carcinoma typically spans several stages, as illustrated below. Early stage. In its initial phases, the tumor is strictly confined to the cervix. Early-stage cervical cancer is frequently asymptomatic, which is why regular screening is critical. When symptoms do appear, they commonly include abnormal vaginal bleeding, e.g., postcoital, intermenstrual, or postmenopausal bleeding, unusual or persistent vaginal discharge. Advanced stage. As the tumor grows, it can invade local pelvic structures or metastasize through the lymphatic system and bloodstream to distant organs. Local invasion. The cancer can spread downward into the vagina, laterally into the perimetrium, connective tissue adjacent to the uterus, or upward into the uterine body. Symptoms of advanced disease: pelvic pain, back pain, lower extremity edema, swelling due to lymphatic obstruction, or urinary/bowel complications if the tumor compresses the bladder or rectum. 4. Prevention and screening. Because of its slow progression, cervical cancer is one of the most preventable types of cancer through 2 primary strategies. Primary prevention: HPV vaccination, highly effective when administered prior to HPV exposure, protecting against the most common oncogenic strains. Secondary prevention: screening, regular pap smears, cytology to detect abnormal cells, and routine HPV DNA testing allow for the detection and removal of precancerous lesions before they can transform into invasive carcinoma. Subscribe, share, comment, like.